Okay, so here is your brain stem. Here's your cerebellum, your coordination area. Here's your inner ear, your vestibular system. Okay, here's an ear for reference. Here's the base of your skull. Here's your spine. Okay, here's your brain, your mind, kind of your upper parts of your brain. And here's your eyes, where your eyes would be for reference. Okay, and so all of these areas converge right in here in an area known as vestibular nuclei. And they are like the processing centers for your all kinds of things, your proprioception, your vision, your balance, your spine, all of these things. And so all this information comes up, loops into here. The inner ear, balance, coordination areas, they all come in here. The visual information all comes in here. Cortical information also comes down into here. I'm not going to draw it in for the sake of arrows, but all this information converges in through here. And what happens is it kicks out that information to this area called your autonomic nervous system, which is what sends a signal down then to your heart and your blood vessels. And it tells the heart and the blood vessels how hard to pump to get blood back up to the brain. So a lot of people have blood flow issues where they're not getting enough blood flow to the brain because these issues occur in here. But what's important to understand, and the whole point of this is to say these things have to match. They have to be sending the same information in that is corresponding to what you're feeling in the neck, corresponds to what your inner ear is sensing in gravity, and what your vision is seeing. What happens for most people is that when they have symptoms, especially neurological symptoms, is that these things start to become out of sync. So this is giving information we'll denote as 1. Now this is giving information that's a 3, so it's different. This starts giving information that's a 5. Maybe the brain is giving information that's a 7, right? And so now information starts to get muddled because now the system is getting all these different bits of data that's not matching up. And so now what it has to do is it has to try to interpret this. And what it typically does is it makes an error. If there's enough errors coming in, it can't do a great job with the information going out. So then we end up affecting not only our blood supply to the brain and other parts of the body, but we also end up affecting the areas that are feeding into it, because it's a two-way street. What goes up must come down. So information coming up from the spine also gets, problematic as we reroute back down to it. Information from the vestibular system, affects the visual system, and now all these things are impacting each other because this is like a big rotary system, and it just slings information to the rest of the brain, which is really important. But if it's not getting information to begin with, then we have a real problem. So this concept is called sensory matching. When they don't match, it's called sensory mismatch. And so when we don't have that working well, this creates symptoms. And that's what we're looking at with most patients that come in. We're fixing and rerouting, retraining the information coming in so that everybody is saying the same thing. We're syncing up the information coming from your visual system. We're syncing the information coming from your vestibular or balance centers. We're syncing the information coming from your spine and syncing the information then coming from your brain. And so when all those things are saying the same message, you end up having, you feel good. When they're not saying the same message, that's what creates symptoms. That's what functional neurology is about, is reconnecting these things and creating a better signal, a matching signal coming in from multiple areas, not just in the brain, but in the body too. That's how we can help people.